So we've known for some time that subtle symptoms of psychosis in patients who are seeking treatment predicts a high risk for full-blown episodes of psychosis. The thing that has been unclear, however, is the degree to which these findings are impacted by treatment seeking. Livny and colleagues make unique use of data from military evaluations in the Israeli Defense Force. These record symptoms of psychosis that are subtle in patients who are not seeking treatment. The important finding to emerge from this study is to show that even among individuals who are not seeking treatment, symptoms of psychosis carry a high risk for full-blown episodes of psychosis in adolescents who are followed throughout their 20s. And this should increase the awareness of the clinician to pay attention to symptoms like these in their patients. As more and more researchers engage in brain imaging, it has become possible to assemble large samples of patients undergoing brain imaging studies. Van Rooij and colleagues report important data that combine data on autism spectrum disorders in many hundreds of patients. Their study looks at the relationship between perturbations in brain structure and the presence of an autism spectrum disorder. A few important findings emerge from this study. First of all, the study does manage to detect findings that relate alterations in brain structure to the presence of an autism spectrum disorder diagnosis. Second, the findings show some heterogeneity in that there are some brain regions, such as in the frontal cortex, where brain structure is increased in patients with autism, and there are other structures, such as the temporal cortex, where structures are decreased. This is important because this is a unique finding, and it suggests that perhaps different psychiatric disorders are associated with different alterations in brain structure. And this should increase interest among both researchers and clinicians alike in learning how these various patterns unfold in different diagnoses.